So thank you everybody, and nice to meet you. Thank you to the beautiful organization, and today to the organization we are going to speak about the artificial intelligence and fertility preservation, ethical and legal implication in the denatality era. I want to thank you also for my co-author, Dr. Marinelli Susanna, that really helped me to prepare this presentation, and hopefully you will find really interesting about that. So the next slide, please. I want to start telling you that I don't have no conflict of interest in this presentation. So as you know, female infertility is a multi-factor problem that depends from many factors as age, lifestyle, smoking, exposure to You hear me?
Sorry, Doc. Yeah, right now. Your voice was muted.
Okay, female infertility is a multi-factor problem that depends from many factors as age, lifestyle, smoking, exposure to pollution, and sexually transmitted infection, especially also HPV, papillomavirus replication in vitro, and in vitro is promoted by hormonal stimulation. The next slide. So infertility is determined by congenital and hormone disorders, lifestyle, environmental hazards, psychological state, and sexual transmitted infection. As you can see in this slide, you know that we are living one of the worst moments about the natality in all the south of Europe, also in the north, more in the south, but in all the world. As you can see in this slide, in Italy, from the unification of Italy to today, you see how the curve is going really down. That's why, because women, the couple choose to plan to have a family when they are a bit older. So you know, when you become older, the fertility is going down, and it determinate and major cause of aneuploidy is a leading genetic cause of birth defects and pregnancy loss. Directly connect to chromosomal errors originating in on site and determinate the curve of natural fertility is going down. So how you can see in this slide that I want to show in my country, in Italy, but in all the south of Europe, the reverse pyramid about the family planning. And not only in Europe, as you can see, in China, has been demonstrated how in 2050, they call the demographic nightmare, because in an attempt to prevent worst case scenarios, the Chinese government has already relaxed in 2016. You know that there is a policy about one child policy. So the results have not been seen because the causes of the low birth rate are rather due to the growing urbanization and the increased female participation in the labor market. In my opinion, it's normal that a woman have to work and everything, but she starts to plan a family when or postpone when it is more older. So this is a really problem, because it's planning that in China also in 2050 there is a really demographic nightmare and going down the fertility. So we published this interesting, and you can find this in PubMed, about how artificial intelligence can help in the treatment of infertility, could improve the assisted reproductive outcomes. The introduction of artificial intelligence in assisted reproductive technology production will revolutionize the future, but is the present. It will definitely need the cautious and the thoughtful approach, particularly when drafting legislative and regulatory frameworks. Ultimate, such goals can only be achieved by preserving human control in order to make artificial intelligence meet our needs. while at the same time offering transparently and active equitable outcomes. So when you speak about fertility, you mean about preserve the fertility. But sometimes we have to think about the cancer, because cancer in women between 15 and 40 years. As you can see in this cake, the most common cancer is breast. After cervix, as you can see, melanoma, thyroid, ovarian, that's all. So we refer, I'm a member of the Escher Society, we refer to the most important society about fertility in the world, the American Society for Reproductive Medicine and the Eschers. About that, I have to remember you that infertility depends on multi-factor, genetic factor, infection, pelvic surgery that can affect the ovarian reserve in an irreversible way. So what happened? You know that chemotherapy and radiotherapy can induce ovarian reserve depletion, menopause, ovarian damage. So you know that when you diagnosticate a cancer, the time early is better chance. You don't have too much time. So a multidisciplinary team that need to help this patient, the oncologist, the gynecology, the psychology, because the ovarian function, the fertility preservation are two aspects that concern the patient, that they influence quality of life and self-exam. So the most used technique to cryopreserve oocyte or embryos is the vitrification system. This is a consolidated technique that needs ovarian stimulation that can be performed in patients also with hormone-sensitive tumors. What we do in this case is to use an anti-estrogen as letrozole. But in that case, usually we prefer, just for family reason, and maybe I can explain later why, we prefer to cryopreserve oocyte than embryo of the couple, because you know, sometimes in a family something cannot go well, so for low region or other region, it's better to have oocyte than embryo. So, as I told you before, a multidisciplinary approach is needed. It's important to provide the information on effects and consequences about the chemo, the radiotherapy, that they are gonadotoxic. And of course, we are speaking about the oncological risk and about the endocrine and reproductive function that can be compromised irreversible. So I told you that during my daily practice and during the ovarian stimulation by gonadotropins, in this kind of patient, we use letrozole. It's a third generation aromatase inhibitor that decreases the estrogen levels by up 9%. This is a publication that I performed during my PhD. We comparing about the vitrification system, the embryo and the neonatal outcomes, about the two techniques about vitrification, open and close, and another arm we compare the outcomes between vitrification and fresh oocyte. But today we speak about genomic, transcriptomic, proteomic, because in my opinion, also the assisted reproductive technology and reproductive medicine in general is going through and ad personam medicine, a tailored medicine, where you have to think about, and we're playing an important role, epigenetic, wireless monitoring, environmental exposure, the imaging, the tissue biomarkers, the genomic and the genetics. So a really, really tailored therapy. And we perform in my hospital, and we publish this interesting paper about the gender medicine IVF that include the gender dimension through the diagnostic and therapeutic process of infertile couples that in their pathway help to eliminate the gender bias, indicating how to design equal access to infertile diagnosis and treatment. So in this scenario, in artificial intelligence, machine learning, deep learning play an important role. Such priorities are all the more essential when reproductive medicine is involved, since it also impacted the interest and well-being of unborn children. Of course, guidelines, recommendations, and the best practice based on widespread international consensus, at least among nations such as Europe, members which share the same set of core values are utmost importance. So what I would like that you take as own message is, of course, the fertility is going down when the patient is going up. You know that one of the best markers is the anti-Mullerian hormone. But an improved understanding of the mechanism in the next futures may be in this present about female reproductive aging, and may be to discover new biomarkers to understand better which oocyte and about the quality and which oocyte is better. So in this scenario, artificial intelligence play an important role, and the indication to cryopreservation is increasing because we speak about fertility preservation, but we speak about also social freezing, because as I told you before, women that postponing their family planning can freeze their gametes, their oocyte, and the growth of egg banks represent for sure an example of the increase in ovarian pathology that reduce ovarian reserve also in young patients, because in our daily practice we see a lot of premature ovarian failure and premature ovarian insufficiency, POI and POF. Thank you very much. Thank you at all, and thank you to my colleague Susanna Marinelli.
Thank you very much. Very great presentation. Let me see any question audience have. Okay, we have a question. Should I read it or you can read? Okay, you can say it in chat box, or should I read?
Okay, what are the ethical implications of artificial intelligence in healthcare? The ethical implication is, in my opinion, as you saw in this slide that I want to show you one more time, is how of the artificial intelligence cannot have to depend always from the man, because you can demand to the artificial implication to reduce the percent of error, but human have to have a bit of the control on the artificial intelligence implication.
Thank you very much. We appreciate your time. Thank you.
And I invited you to read this paper that we published, because it explains everything about also the value of regulatory frameworks about that.
Okay, thank you.